Medieval doctors used leeches to cure diseases. Imagine going to the doctor because you have a fever, and instead of medicine, they pull out a jar of live leeches and stick them onto your skin. As horrifying as that sounds, this was considered cutting-edge medical science in medieval Europe. For centuries, doctors believed leeches could cure everything from headaches to the plague. But why did they believe this, and did it actually work? Let's dive into one of the strangest chapters in medical history. To understand leeches, we need to understand how medieval doctors viewed the human body. Medieval medicine was based on an ancient Greek theory called the four humors. According to this belief, the human body was controlled by four fluids: blood, phlegm, yellow bile, black bile. Good health meant these fluids were in perfect balance. Illness meant one humor was too strong, especially too much blood. So if someone was sick, doctors believed the solution was simple: remove the excess blood. This is where leeches came in. Leeches were ideal because they could remove blood slowly and precisely. They didn't require cutting veins with knives. They were easy to collect from ponds and rivers. Doctors believed leeches could draw out bad blood and toxins from the body. Different diseases required leeches to be placed on different body parts. Headaches, right pointing arrow leeches on the temples. Fevers, right pointing arrow leeches on the arms or legs. Mental illness, right pointing arrow leeches behind the ears. Internal pain, right pointing arrow leeches near the affected organ. Some patients had dozens of leeches applied in a single treatment. A medieval leech treatment was not pleasant. The doctor would clean the skin, sometimes with wine or vinegar, place live leeches directly onto the body, wait as the leeches attached and began feeding. Each leech could drink several times its own body weight in blood. Once full, the leech would fall off, or be removed manually. Patients often felt dizziness, weakness, extreme blood loss. In some cases, patients were bled so much that they died from the treatment, not the disease. Surprisingly, sometimes, yes, leech saliva contains anticoagulants to prevent blood clotting, anti-inflammatory compounds, mild painkillers. In rare cases, reducing blood pressure or inflammation may have temporarily helped symptoms. But for most illnesses, infections, plague, organ failure, leeches did nothing or made things worse. Bloodletting weakened patients who were already sick, reducing their chance of survival. Leech therapy became so popular that Europe faced leech shortages. Hospitals and doctors paid large sums for medical leeches. Some countries even regulated leech harvesting. By the 18th and early 19th centuries, millions of leeches were used every year across Europe. Leeches became a symbol of medicine itself, appearing in medical texts, tools, and illustrations. Here's the twist: leeches never fully disappeared. Today, modern medicine still uses leeches, but for very specific reasons. Reattaching fingers or ears, preventing blood clots after surgery, improving blood circulation in damaged tissue. Medical leeches are now sterile, controlled, and scientifically understood. So medieval doctors were wrong about why leeches worked, but not completely wrong about how they could help. For centuries, medieval doctors believed leeches were the key to curing disease. While their science was flawed, their observations helped shape early medical practice. So the next time you hear about leeches in medicine, remember, what once seemed barbaric laid the groundwork for modern healing. If you enjoyed this deep dive into strange medical history, like, subscribe, and comment. History is wild below.